Welcome, everyone. It's so incredible to have so many of you joining us today. Thank you for being here. My name is Lauren McCormick, and I'm an undergraduate student at UNC Chapel Hill and a member of the Right to Health Action Planning team for this webinar. Right to Health Action is a grassroots movement of volunteers dedicated to pragmatically fighting for health equity. We came together as a team in response to the COVID-19 pandemic based on a shared belief that health is a human right. In our last webinar, we used a participatory, community-centered lens to explore the interconnected nature of COVID-19 and climate justice. Today, we will continue to focus on community-oriented work and dive into what it means for a public health response to be country-owned and community-led. We will discuss how such programs have been successfully developed and implemented in the past, then explore how that history can inform our efforts to end the COVID-19 pandemic and prevent similar crises in the future. Pandemics are, by definition, global. Yet the US and much of the world's response thus far has been overtly nationalistic and, particularly in the case of the United States, rather unsuccessful. In today's discussion, we want to explore an alternative vision, one in which countries collaborate and stand in solidarity with one another in the face of a challenge that impacts us all. We hope that today's discussion will allow us all to imagine what a sustainable global response to this pandemic could and should look like. Before we get started with our panel, we'd like to know a bit more about you all so we can have a better sense of who our audience is. To that end, we have two quick demographic questions for you to answer before we begin. They should be popping up on your screen right now, and I'll give you a few moments to complete them before continuing. Thank you all for answering those couple of questions for us. Knowing this information will help us to better understand who we are engaging and where we could use additional outreach. Now, to get into the plan for today, we will begin with a panel discussion during which we will hear from Professor Agnes Binagwaho, the Vice Chancellor of the University of Global Health Equity in Rwanda, Chris Collins, the President and CEO of Friends of the Global Fight Against AIDS, Tuberculosis, and Malaria, Kumba Tekuyama, the Community-Based Program Manager of Partners in Health Sierra Leone, and Dr. Bailor Barrie, a Strategic Advisor to the Executive Director of Partners in Health Sierra Leone and the founder of the Well-Body Alliance. Following our panel and an audience Q&A, we will invite each of you to join a small group discussion to debrief, highlight points of resonance, and discuss concrete actions we can take in this very important moment. We have a team of trained small group facilitators who have stepped up to create space for these conversations, and we want to offer a huge thanks to them for taking this on. After our small group discussions, we will once again join together as a larger group to debrief next steps regarding the actions we hope each of you will elect to take. Before we begin, I just want to give a couple of notes on technology. First, all attendees will be muted during the panel discussion. You are welcome to submit questions via the Q&A tool at any time, and we will refer to these questions during an audience Q&A session after the panel. And we really encourage you to do this. It makes for a much more interesting discussion during the Q&A portion of the event. Next, I want to give a shout out to Erin from our team, who is currently typing out closed captioning for the panel. We are also recording the panel portion of this webinar, and that will be shared in the coming week if you want to refer back to anything that you heard or share it with anybody. And finally, after the panel and Q&A, we will share specific instructions surrounding the logistics for moving to small group discussions. Now, before we get started, I want to offer one last word of thanks. We have an amazing team of more than 20 people who have met multiple times per week and put in many hours to planning this event. I want to thank all of them for all of their hard work. And if you're interested in being involved with this team going forward, we'll be following up with information as possible. And with that, I'm pleased to introduce our wonderful moderator for today, Ms. Michaela Newman. Michaela is a policy and research officer with the Lancet and Financial Times Commission, Governing Health Futures 2030. As a part of this commission, she is exploring the intersections of health, technology, governance, and the flourishing of future generations. Michaela, thank you for being here with us today.
Thank you for setting the stage for today's conversation, Lauren. And thank you all to the panel here. I'm looking forward to today's conversation. COVID-19 has emphasized the need not only for more resilient health systems, but for collaborative conversations about ways forward together. This pandemic highlighted huge tensions between geopolitical agendas and the health, security, and well-being of populations. I spoke with the science fiction author Ken Liu just yesterday, and he told me that when science fiction authors write about future catastrophe, there's often a pull toward a narrative of global solidarity, people banding together behind their common humanity. COVID-19 so far has presented a different reality. Conversations like the one we're having today help to pave a new way forward, a way led by grassroots activism and community co-creation. As the poet Lucille Clifton wrote, "Cannot what we cannot imagine." I'm so looking forward to imagining sustainable, collective, country-owned and community-led responses to this and future pandemics with this great panel, who I have the pleasure of introducing now. Professor Agnes Binagwaho is a Rwandan pediatrician, Vice Chancellor of the University of Global Health Equity in Rwanda, and Special Advisor to the WHO Director General. She formerly served in the Rwandan Health Ministry, including 5 years as the country's Minister of Health. Chris Collins is the President and CEO of Friends of the Global Fight Against AIDS, Tuberculosis, and Malaria. He is a longtime advocate through roles at UNAIDS and AMFAR for domestic and global research and investment in these epidemics, always with the guidance and involvement of civil society in the response. Kumba Tekuyama is the community-based program manager for Partners in Health Sierra Leone. Kumba started her community work with Partners in Health Sierra Leone in 2015 during the Ebola epidemic. She is passionate about community work and is a strong advocate for the poor and underprivileged. She believes health is a human right for all. And Dr. Bailor Barrie is a Sierra Leone physician and the founder of the Well Body Alliance Clinic. During Sierra Leone's Ebola epidemic, Dr. Barrie and the Well Body Alliance Clinic collaborated with Partners in Health to respond to the disease. Currently, he serves as the strategic advisor to the executive director of the Partners in Health Sierra Leone office. Welcome, welcome to today's conversation. My goal as moderator is to bring us to a note on hope by the end of this. But to start, I'd love to ask you what your greatest concern is for your community with regards to COVID-19. What keeps you up at night? What scares you the most about what's happening right now? Kumba, if we could start with you.
Well, for me, what keeps me up at night, it's the community denial regarding COVID-19. Because communities have not been believing that COVID-19 is real. With all what they've been seeing on social media, what have been happening in countries that are richer, that have more resources, are struggling, the denial rate in community is great. So for me, that keeps me up at night. Even though we've been through an epidemic before, which is Ebola, but still the denial rates of COVID-19 is high. So that kind of keeps me up at night. Like,
But we seem to have lost you for the moment. So perhaps in the meantime, we will turn to you, Bailor.
Yeah, so for me, what my greatest concern is during Ebola, the outbreak came and people were, at the start of the Ebola, people did not believe Ebola exists, and like there were a lot of conspiracy theories developed. But then as time goes on, people started surviving and people started getting care, people started believing that, yeah, it's true, Ebola exists, and people were going to the facility when they get sick. But right now, it's the opposite. At the beginning, at the start of the corona outbreak, people believe that, oh yes, corona is real and it's gonna like cause a lot of havoc in the country. But as the trend is slow and people are seeing a lot of survivors, and they started denying. They started saying, "Oh, well, we don't believe Corona is real, and like, how could we be better than all those countries like America, like Italy, and whatever, or even if the Corona that is existing in those countries is not the one that is in Sierra Leone." So people started denying, and so that keeps me worried. And what really keeps me um, like not sleeping at night is just thinking about like we're like in a time bomb currently, because the outbreaks seem to be slow and rising, but we're not sure why that's happening. And maybe we might be sitting on a time bomb that will just have an explosion of cases and all those things. So that really keeps me worried. And the fact that like still the country or the country is not like trying to build permanent structures. During Ebola, we built like the EOC, which is Emergency Operations Center, from which we're able to piggyback on and build the structures for Corona. But like right now, I sit in the Corona and the surveillance pillar. They're not like even taking it serious. They're not even like the enthusiasm that they started with during the start of the outbreak has dwindled down, and people are not like basically thinking about how do we move forward from this outbreak. That really keeps me worried.
Thank you. And Prof. Agnes, perhaps you can give your response.
I think that what keeps me awake at night is more the long-term impact of the situation now, because it is destroying economy directly and indirectly. I don't believe that it's coronavirus that destroy economy in Africa. It's the global disruption in economy that destroyed the economy in Africa. But it will last. And out of it, we may, I don't know. That's my problem, is what I don't know. We may face pushback in health gain in other area. So this is for me quite concerning. And the other thing is what we still don't know scientifically. Because, okay, it's very strange to say 6 months later it's a new virus, but we start seeing people with permanent, mid-term brain damage, incoordination, etc. So what will remain after that? What makes me very optimistic, on contrary of my colleague, is that Africa has done quite well, even if the world doesn't want to recognize that. And this is, again, a Western focus analysis of the world. Africa have shut down the plane, lockdown, and did great. And the result of the fact that in many countries, not in all, but in countries where Corona didn't penetrate in the community as a national epidemic, it's still manageable. And I understand that the population doesn't feel all the drama and all the what the world do around this, because it's not their day-to-day life. They just see the negative impact of the measure taken, not the positive impact on their health, because they don't see that their health are impacted. So economy, what we don't know, and continue to continue the right information for the community to continue to have the right attitude to help the people in charge to continue to manage correctly the pandemic.
Thank you. And Chris, it'd be great to hear from you.
Yeah, I think what keeps me up at night is the worry that, like Agnes, the leaders of countries around the world, including donor countries, won't realize how serious a situation this is, and how COVID, however bad it winds up being in low and middle income countries, could have a devastating impact in terms of accelerating the AIDS, TB, and malaria epidemics. You know, we're already seen that about 3/4 of AIDS, TB, and malaria programs where the Global Fund is active are reporting holdups in delivery of commodities and other delivery of services. And I worry that that's only going to get worse, that people are going to be cautious about coming forward to health centers to getting the treatment and prevention services they need. And we're already seeing in some places that people are not accessing, for example, ARVs to treat HIV at the rate that they used to. UN agencies have estimated that the long-term impact on HTB and malaria programming we could see mortality nearly double from those 3 diseases as a result of COVID, setting back, sending mortality back to where it hasn't been in AIDS and TB by a full decade. And in malaria, possibly we could go backwards 2 decades and lose all that progress that so many people have worked so hard on. So there could be a real tragedy that unfolds that people don't see because they're looking at the COVID numbers and they're saying, oh, those COVID numbers aren't quite as bad as we worried they might be. The truth is what's going on behind that in the health systems that are being devastated, and the reduced, access to services. I also need to include vaccination. What about all those kids that we've seen reduced uptake of vaccination in my own country in the United States, but also in many other countries? That's long-term going to mean more disease among kids. So it's really frightening to me. And I think what we all have to do, I will just lead off with my pitch for today's webinar, which is there's a lot of things we can do about it. One thing we can do about it is get governments to support the Global Fund's COVID-19 response mechanism. And that response mechanism is to do a few things. One is to mitigate the damage to AIDS, TB, and malaria programs, to do kind of a retrofit on those programs so they can continue to deliver services even in the harder circumstances of COVID. The other thing that mechanism set up to do is to get protection, PPEs to community healthcare workers, get diagnostics out, soon get a treatment out in Africa and elsewhere. So that fund needs support, but you'll see my little electronic background here is a graph we made showing that, the Global Fund initially put $500 million of reprogrammed money into this fund, and there's been a lot of demand for it. So the availability of the funding is steadily reduced. Germany stepped forward with about $165 million. And now we're in the process of spending that down. By September, that money is gone. The Global Fund will have no money at all to do anything extra to help on COVID or mitigate damage against AIDS, TB, and malaria. So I can say in my country, in the United States, it's an absolutely critical month. And for everybody who's joining from the US, I really urge you, and I hope and I ask that you will organize and reach out to members of Congress and organize in your organizations to do this, to demand $20 billion in funding for the global response overall in the supplemental being debated, and $4 billion for both Gavi and for the Global Fund over 2 years.
Thanks, Chris. And some very, very provocative comments from each of you about addressing denial and potential loss in health gains, understanding what we do not know and how to prepare for that, and getting the right information out there so that we can have the foresight we need to address COVID-19, but also all the other health systems needs that our countries have. So thank you very much for that introduction to our discussion today. As the next question, we would like to hear from you about examples of community-led and country-owned responses in public health today, and what best practices and key learnings there are that we can consider from these responses. As with so many things, it's often better to look to the past and what's worked as we plan what needs to be done for a sustainable future health system. So how can these lessons be applied to the current pandemic and to prevent future pandemics? To kick off, it would be great to hear from you, Bailor.
So I think what I want to talk about is what happened during Ebola. It's a typical example of how community-led response could be sustainable and successful. Like during the Ebola outbreak, I was fortunate to be part of like the PIH community engagement program, where we designed the contact tracing and community-based program and implemented it. But one important thing that I want to say is what is the difference is that during Ebola, the public health response was actually handled by the government and programs and everything. And the clinical aspects of Ebola was handled by experts. And it's understandable because the country is like, we lack healthcare professionals. We don't have enough numbers of doctors or clinicians. So it's great to like allow clinicians and doctors to come and support. But like the government took the bold step to lead the community response by engaging the paramount chiefs, engaging the community itself, and like putting bylaws and all those things helped to contain the outbreak and made it not to be, I mean, it's bad, but it's not worse as it would have been if those steps were not taken. So, and I saw firsthand as a leader in leading the community-based program, I saw how effective the community-based program was. Like when we're having community health workers visit house to house, educate people, ask questions and listen to them, listen to their concern. We link them to social support and like, so it's helped a lot. And I will leave that to Kumba because she was leading the psychosocial program during that thing. And she was like responsible for making sure quarantine homes and all those things where they receive their food supplies and all those things. But like we designed a program that really took off and I was taken by the whole country, which was great and helped contain the virus. And so what the lesson learned there is like, when you hand the community the response in the countries, it's like the people or the citizens of the country know their problem, they know how to handle them, and they know how the steps to take to contain any outbreak. And then you can help through the things that they don't have, like clinicians and all that. I think doing Ebola, that's what I really liked. And during this COVID, it's like all the countries, the Western countries and everybody are affected. So clinicians do not come, airports are closed, and there were not many clinicians. But the community and also the structures that were built during Ebola were the same structures that were activated, and they're in place. It's just that the enthusiasm from these people working, and also the major problem is the resources. Like, so they don't have limited resources to respond to the Ebola outbreak. As Chris Collins said, like, we need, even though these countries these European countries, American countries are affected, but still they're better than some of those countries in Africa in terms of resources. And they should also mobilize resources to support those countries, because I think that is what is lacking in this current outbreak, is resources to activate and function and like activate and make these structures functional. Then we could be safe, I think. Yeah, thanks.
Kumba, would you like to jump in?
Yes, so just like what Dr. Barrie is saying, the involvement of local community leadership in discussing and implementing any response is really important, because when you involve community members, like the community structure, like the chiefs, the youth chairman, the women's leader, they kind of have ownership over the program, and giving them that opportunity to contribute in how to like go about fighting the response, make them really feel like they are involved in it, and helps you identify like areas you can support them with, instead of you going to them and telling them, this is what we want to support you. Giving them that opportunity to tell you what kind of support they want is really important. So involvement of community leadership in any response or pandemic is very important and key. And like what doctor was saying, like some of the best practices and learning from Ebola, was training community health workers or members as agents of raising awareness on preventive measures, serving as active case finders and contact tracers. So when you get community members from the community they stay in to do this, it's kind of build trust among the community people.
Excellent. And Dr. Agnes, what about your response?
So I am living in somehow another country where the community is involved since 2000, meaning there is nothing where the community is not involved. That means it's easy because health policy says don't have health policies or guidelines, etc., without the involvement of the people you serve. So here, and this brings a better synergy with what the government can do and what the community can do. Because separately, I don't understand how it can work, because hospitals cannot be led by the community. They need public money. They need the budget. They need the support of the ministry. And also, even all those campaigns, all those informations, we need entities that bring together the knowledge of the day and customize it with the community to serve the community. I'm going to give you an example. When there is a lockdown, people cannot understand why you lock down for something we don't have faced yet. And the only people who can really inform the communities and be trusted it's not people like me. It's people from the village, the community health workers. We have 4 community health workers by village. A village is maximum 200 houses. So you see it's a lot of people elected by them. And when they are elected, the Ministry of Health have to educate them so that they can treat diarrhea, pneumonia, etc., etc. So passing through this channel that is strong and build on in day-to-day basis, not when there is a crisis, it's very easy to leverage it. With the churches, the same. Very good relation with the churches, all the churches, Anglican, Catholic, Muslim, all of them. Meaning when the world started to talk about a big epidemic, a pandemic, all the churches were brought together by the Ministry of Health and discussion, informing the church leaders so that they can give the information to the churches. So easy, because the spiritual leader has far more power than I can never have. So that means the lesson I can say here is that we need to build this channel, those synergy, those communication, those strong things, not when there is a pandemic, so that we can use them when there is an outbreak. And if not, those who will suffer will be the people at community level.
Mm.
And for example, we lock down, people who are poor own their money on day-to-day basis, so they have no food. The village, the 200 houses have a chief elected by the people. The chief has to inform up to the central level who in those houses that they are leading cannot afford the food of a day. And they receive the budget for that so that the people can stay home safe with nutrition. So this is the link we have with community.
And Chris, we could hear from you.
Yeah, I mean, I think the lesson of the AIDS movement, which is the health movement I come out of, is that none of this works without community engagement at every level. It takes the community mobilization to get the funding in place, to push for the research you need, to help design the delivery of interventions in a way that works for people, different kinds of people, to scale delivery of services to the community, and in particular to reach people who are marginalized in societies. It takes trusted community workers to get beyond the health system and reach folks that may be locked out socially or politically or economically. So it's absolutely essential. You know, the good news is that the powers that be in global health certainly pay lip service to the importance of that. But for so long, we haven't really seen the structures for community engagement at the big global health decision-making level or the funding for it. Now, things are getting better in terms of decision-making and inclusion. Global Fund includes community delegations on its board, which is wonderful. And also its structure is that each country with a Global Fund grant is supposed to have a country coordinating mechanism that includes civil society and includes affected populations. So that's great. There's always room for improvement in how that system works, but it's a great system on which to, you know, improve and build upon. The US Global AIDS Program, PEPFAR, has really done a lot better in the last 4 or 5 years in terms of engaging community through their country operational planning process, sitting down with community members in each country as the plan is being put together. Again, not a perfect system, but I think on the road to improvement. But I think one of the things that I'm hoping that comes out of COVID and this disaster is realizing that not only do we need to invest in health systems more broadly, but that we need to be investing in community as advocates and as monitors and mobilizers and to do accountability on their governments and on the donors that are contributing. I'm part of a group now that's trying to bolster funding for national-based advocacy in countries. And you know, we're trying to bring together data on funding that goes for advocacy at the national level. There's not even data out there. I mean, no one's even tracking this. There are a few relatively small donor programs to fund national-based advocacy, but very small. And we've just got to absolutely turn that around so that donor programs, whether they be multilateral, bilateral, but also private philanthropy, that we're tracking what we're investing into community-based advocacy at the national level, and that we're funding it. We're really scaling up the advocacy for that, because that's the only way that country ownership works, unless it's going to just mean government ownership. If it's going to mean ownership by the whole society, you've got to invest in people participating. You've got to give them a seat at the table, and you've got to put resources behind them and supports. And as COVID drives all of us to think more in terms of strengthening systems and delivering on people's needs today, but also being prepared for global health emergencies of the future, investing in community advocacy and service delivery is, I think, front and center, or should be.
Excellent. It sounds like you guys are very well aligned in acknowledging that country leadership often knows what is needed, but sometimes there's a lack of resources in order to kind of activate that response, and that this exchange between community and communities and government is critical in order to create the synergy necessary. But I guess a follow-up question for those of you who have spoken about there being a sense of denial or more of just fatigue about the impact on economy and other things without acknowledging the impact on health, because health so far has been more or less okay when it comes to COVID-19 response in these countries as opposed to the US. What is necessary between communities and country leadership to set the tone for what's required in the next step as we prepare for this unknown time bomb that's alluded to? If I could throw that out to you guys for a quick response, that would be great.
Could you define the question a little bit more? I'm sorry, I didn't quite, yeah.
Absolutely. So it sounds like because of the context in some of these African countries that we're discussing, COVID-19, there's a sense of denial around it. So in order to create this sense of urgency for this advocacy, for an investment in the response, what is needed to bridge any gap between community and country beyond resources?
If you don't say who is going first, we are all going to watch each other.
Okay. Well, Dr. Agnes, I feel like you've volunteered.
No, I don't volunteer, but what could bridge the gap is to first of all, to stop the global lies. That's so every day. It's amazing what people can go to an extent I even don't understand, when the FDA now say that people without symptoms cannot should not test just because there is a political push for not testing. How so my problem, if we want to bridge and to go forward, and if we want the world to continue to trust science, stop lying, and make people accountable for their lie. I would like to know how many people they have killed and put them at trial to lie and international tribunals because they are criminals. Mm-hmm. So, and the community has listened to the radio. So after that, you come to them and tell, you should do this, and no, we have the poor people, the powerful people in the world who say the contrary. So we are fighting not a disease, we are fighting a lie, a branch of lie about a disease, but the disease is the lie by itself. So this, and also how to continue to build solidarity and strong leadership, because now people politicize everything around the world. I'm so grateful to not be in a country where it's like that, but I'm crying when I look what the impact they have on the world, and that impact will be amazingly bad.
Thank you for that very candid response. I don't know if there's anything that anyone wants to add.
Yes,
so
good.
As a follow-up. Okay, go ahead, Kumba.
Yes, so just to add to what Dr. Agnes was saying, like to bridge the gap, we have to continue to involve community leadership in all decision making, like developing future preparedness plan or response plan, and spelling out clearly what's going to be like the community portion and involve them in the development.
Thank you. And Bailor, if you want to chime in.
It's just like I wanted to just follow up on what Dr. Agnes said before, like when you use the community structures, and these are people that are well trusted in the community, they can actually overcome some of the lies. As she said, there are a lot of lies going on around, but like when you have someone in the community, like I know Kumba, we designed a community-based program in Kono where social mobilizers are moving house to house. When you sit with someone and you're talking, you're giving an opportunity for him or her to ask questions about things that they don't know, and you provide the answer. That is better than when you just talk at people, or like, oh, radios or megaphones or all those things. They're somehow effective, but the most effective engagement is when you sit with someone one-on-one when you sit with someone one-on-one and they're talking and sees you and he asks questions and they're able to respond. That's the most powerful thing to do. So I think community health workers are a very powerful human resource in every country, even in America, in the UK, and all those things. Community health workers are key to turning around this pandemic.
Excellent. So our next question is how we balance this current pandemic with other existing public health challenges, and how COVID-19 is shaping, or as kind of was what was mentioned by Chris, maybe detracting from current public health needs. So Chris, because you opened earlier with some of these remarks about the impact of COVID-19 on HIV/AIDS, malaria, and tuberculosis, I'd love to start with you on this one.
Well, I'm sorry, the question is, what's the need? What is the need?
How is the current pandemic existing alongside other public health challenges and shaping needs for health systems?
From what I can see so far, it's doing a huge amount of damage and we're not talking about it. It's, first of all, undermining health systems as personnel and resources and physical space is rededicated to dealing with COVID, which it needs to be in the short run, but that means that you're taking resources away from responses to other health needs, which were already under-resourced. There wasn't extra there to pull on. So there's a real risk of undermining the responses to the major infectious diseases, to other areas of the health system, and that we're ultimately weakening health systems all over the world by doing that. You know, on a personal level, people, I understand it, I don't want to go visit my doctor myself. I don't want to go indoors into his clinic. People are, wary of going to the doctor. That's understandable. But that means that the health system needs to respond to that new reality for people and reach out to them with services directly to their homes or places where they can feel they can safely access services. And all of that change requires flexibility from all of us and the willingness to, see more broadly than just what's the latest COVID statistic, but rather understand COVID is entering into very complex health systems. And we need to think about all the complexity of those systems, even as we're concentrating on COVID. And yes, part of that is resources. This is a time to recognize we are under-resourced in terms of health responses in countries all over the world. We have been chronically under-financing the effort to end the AIDS, TB, and malaria epidemics from the beginning. Even for all the progress we've made, we're not on track to end those epidemics, even though we could be if we chose to be. COVID is making that harder, and it's taking resources away from those efforts. So it is a time, there have been moments where even with all the nationalism going on in governments all over the world, which is deeply concerning, you've seen some really bright moments in global health over the last year. The replenishment for the Global Fund last October was very successful. They raised $14 billion in pledges, the largest amount ever pledged for global health to a multilateral institution in history in the midst of all these nationalist movements. The replenishment for Gavi just happened a couple months ago, and it was wildly successful. So the world, donors are capable, even now, of coming forward and thinking globally in the way that they invest. But we simply have not seen that in the case of COVID, and also shoring up the responses that donors have been investing in terms of infectious disease and vaccination. I can only speak for the United States, but I think here, as others have noted, well, the response has been so tragic, and we've got such a severe epidemic here in the United States. I think it's difficult for the public and for politicians and for key constituencies to even think that much about global, because we're so concerned about our own country. But we've got to get out of that format and realize that we have to be, this is a pandemic, it's by definition, it's global. We've got to be acting globally. No one in any country is safe until we've addressed COVID and other infectious disease knock-on effects around the world. So we've got to think globally. In the United States, we've had over $3 trillion so far has been spent on the COVID response. Less than 0.1% of that has gone to the global COVID response. Crazy. It doesn't make sense. Even if you're just thinking about the safety of people in the United States, it doesn't make sense. So we've got to turn that around. In implementing countries and in donor countries, this is the moment to realize we need to invest in systems and communities and step up the investment in health.
Thank you, Chris. And Dr. Agnes, if I could hand over to you for that question as well.
So say the question again, because Chris went in so many interesting things that I forgot the question.
I think we could unpack that for quite a few minutes. So the question is how the current pandemic is existing alongside other public health needs shaping health.
So again, I think you don't prepare the safety of your people in the middle of a war. And I'm going just to give you what we have done in Rwanda. And it's not to be replicated because it has to be adapted to each and every country. To avoid people sick to go and infect people in hospital, you are not allowed to go to an hospital if you believe you are sick. there is a phone you can call, a number. And each village, I told you, the village system, there are 4 community health workers with 4 phones. So they call for you an ambulance who come to pick you home with people protected and a driver protected and bring you directly to a center where you are isolated, tested, and with the result, and you go in quarantine if you are positive and not so sick, or you go for treatment. You avoid to contaminate people who are coming from other care. And you make that known to the population so they are not afraid to come and deliver to the hospital, come to vaccinate the kids, come to take their drugs for HIV, come to test for TB if they have a problem that can be TB. So this should be the duty of any leader in the health sector. And now what happened, it's with the lockdown already, because of the lockdown, there is less transportation. So people use less the health services because there is a problem to get transport to get there. But at least services are there and they can call an ambulance. So that's my advice. Create, we all know, you know, all the ministries of health in the world have a department in charge of outbreaks, okay? They should prepare such a thing before the outbreak, not before, not after. And the other thing is, you know, the accountability of mismanagement should be a real thing for people. The mismanagement in US, it's unbelievable. And the people in US should know that that should not have been the response. And they should not look to Africa. They can look to Portugal, okay. They can look to Vietnam. Countries with a little number of deaths and a pandemic as well, just because of good management. And this is not allowed. This should not be allowed. Because health is a human right. And it's the duty of government to make it. So there should not be disruption. There should be preparation. And if it was not the case now, let's think about the next pandemic, because the next pandemic, we don't know when it will be there. It can be tomorrow. It can be in 2 years. It can be 20 years, but it will be there.
Absolutely. Thank you. Dr. Bailor, if we could hear from you.
Yes, so thank you, and thank God that in Sierra Leone for this COVID is actually, it's not impacting people going to the facilities quickly. Although at the start, there we saw a drop in patient attendance and in facilities in Kono and across the country. And also, like, there was an incident that happened, like in the surgery department in the main referral hospital. One doctor got infected. They shut down all the ORs, and like the pediatric hospital also shut down because clinicians were infected. But then quickly, the country was able to react by saying, okay, let's develop policies for healthcare workers that when they get infected, what to do so that the hospital will not be shut down or the department will not be shut down. And they invited partners in health to help with other partners. We developed that policy that helps that when someone is infected, they have policies to make sure that the hospital is not closed. And right now in Kono, we're also seeing that patient attendance in the facilities are rising based on, thanks to Kumba, the community-based program that they're doing house to house. They're educating people to understand that, like, if you get sick, go to the hospital or go to the facility, you get care, and like the hospitals are open. But the challenge is like, it's not all clinicians that are trained in the country to be able to identify cases and suspects and refer them for testing or whatever. So we're missing cases there, but like we're moving towards that direction. And I think for Sierra Leone, I'm happy with the way the response on making sure people attend clinics and like they still go to the facilities, even though in other districts that they're not implementing the program that we have in Kono. We're seeing a little drop, but not a deep drop, not a deep drop in the patient attendance. So, but as to Chris' point, it's like because of COVID, a lot of things happen within the ministry. Like a lot of directors were moved from their positions into COVID, and that impacted the public health response for other conditions. Like the director of reproductive health was moved in; she's the head of surveillance right now, and like the director of primary health care is moved into the head of contact tracing. So most of the directors in the ministry that are responsible for other programs were moved to COVID, and that is impacting their program, like the reproductive health and reproductive and child health, or the primary health care and all those. It's impacting them because the leader is moved into COVID. And but last week we had a meeting at the EOC, and there was the discussion coming to make sure that how do we integrate COVID into the health system? So it's not responded in a silo, but integrating it into the health system and make sure that we're able to respond to cases and without disrupting the health system. So I think for Sierra Leone, I think we're moving in the right direction on that front. Thank you.
Thank you. And Kumba, if we could give you the last word.
Yes, so for we to balance this current pandemic with other existing public health challenges, we need to invest in community-based care. Because in many settings, community health work already forms the backbone for primary health care provision, Like in the context of COVID, the use of community health workers and other technology that facilitate home-based care present opportunities like to continue providing services outside of health facilities. So if we invest in like community-based care, wherein community health workers will be out there in the community, like do screening, refer people with more acute needs to the higher level of care, that helps a lot during an outbreak, because like for example, with the lockdown, most of our patients were not able to access the facility. But because we have a community-based program that have community health workers that goes out to these patients, see these patients on a daily basis, they were able to make sure like the patients have their medication and also refer these patients if there is an emergency. So the best way we can be able to balance this pandemic and also like public health challenges is to invest in community-based care.
Thank you. There's been a lot of conversation around how we can create better relationships within countries. And I'd love to hear from all of you about how we also build solidarity and allyship, coordination and cooperation between countries to strengthen this response, because as Chris mentioned, it's a pandemic, it's global by nature. So Dr. Agnes, if I could start with you on this one.
I think that we have a tool that we are using now. We are in how many countries, the people are around this discussion, how many continents. And I think we should use that, helping people to create the network inside the community for those who doesn't have access to internet, but having them and have a community of practice, and Partner in Health is very good in doing that. And I think we should all think how to make it work even better further by helping Kumba and others to relay this network inside the community for people who doesn't have access to internet, and exchange intensively solution, new problem, challenges, how your community have find a solution, because they are smarter than we are, and they are living the problems and they have the solution quicker than we can never have. So community of practice, but with antenna inside each and every communities, even those who doesn't have internet.
Thank you. And Kumba, we can hear from you as well.
So I think like regular coordinating meeting, because we don't just have to meet because there is an outbreak or a response. Like meeting even when there is not an outbreak is really important, because most of the times we, like countries or different organizations, just come together to meet, to coordinate and to plan when there is an outbreak. I think meeting before even an outbreak, like having a regular coordination meetings through visual, or if possible, like cross-border meetings to share best practices and agree on like common measures in fighting disease. It's really important if we can think about that.
Thank you. And Bailor, your response?
I would toe the line of both Dr. Agnes and Professor Agnes and Kumba, that we need to be proactive and not wait when there is an outbreak to start acting, but like we should think about having a continental response plan, and I will encourage like the African CDC and like all those things to form like a continental structure that will respond to outbreaks rather than relying on the West or whatever. But the continent should come together and like come with a coordination, and as Kumba said, meet regularly, not when there is an outbreak. That could be the way forward. Thanks.
Thank you. And Chris, I'll give you the final word on this question. And a follow-up is kind of, what US-based activists can do to support these global efforts, given our role as leaders once before in some of these global responses.
US-based advocates, September is your month. We really need to act in September. But so, I mean, first I would just say, I mean, I hope that by the end of COVID-19, we've all, I'm speaking for lawmakers in my own country, have recognized our connectedness to the rest of the world and the absolute necessity, whether you're talking about selfish reasons or humanitarian reasons, for us to be acting globally and help people create the health systems they want to create. In the United States, there's growing interest in the idea of pandemic preparedness. That's no surprise. Both the current administration and the Senate are looking at creating a pandemic office within the State Department. And I think that's all well and good. We've learned that we need stronger systems to be prepared. But I think the challenge for, at least in the United States, and I would say maybe for other donor countries, is not to interpret or understand preparedness narrowly, but rather realize that to really be prepared, we need to have broad-based health systems that can deliver today for people for the variety of needs they have, but also, the clinics, the laboratories that are able to provide today for people's needs, but are also flexible and can adjust when there is a new pandemic that emerges. So we need to, yes, I think as advocates, understand that lawmakers are interested in the concept of preparedness right now, and we need to tell them what that really means, which is building up health systems that can respond to people's needs today, that are also flexible to identify challenges of tomorrow and respond tomorrow. What can you do? In the United States and every donor country, you can contact your elected officials and tell them we need money into the Global Fund's COVID-19 response mechanism. That is one way to get money on the ground in low and middle income countries to respond to COVID and shore up the responses to AIDS, TB, and malaria. It's got to happen in the next couple weeks in the United States. We've got Congress looking at a supplemental appropriations bill, probably will come to fruition end of September. There's way too little in the dialogue right now about the global response in general. The One Campaign Interaction and U.S. Global Leadership Coalition are calling for $20 billion overall for global, and part of that is $4 billion for the Global Fund's COVID-19 response mechanism. So I know it's a little corny, but if you're based in the U.S., please call your member of the House and your 2 senators' offices and tell them you need $20 billion in global investment in the next supplemental.
Thank you. So we're about to enter our Q&A session, but at the beginning of this panel, I had mentioned that I'd love for us to end on a hopeful note as well. So I'd love to do a very, very quick around the web room on what community response has given you hope during this pandemic and through this very uncertain time. So Kumba, we could start with you. Kumba, you're on mute.
So the hope that have been given to me during this pandemic is like working with community health structures to use like local resources, including the fabric masks, and using locally made soap for hand washing for preventive measures. And also like kind of recruiting and training community dwellers to serve the community through household model as a way of promoting universal health coverage. So that has really given me hope.
Excellent, thank you. Dr. Agnes, if we can hear from you.
I have a lot of hope, so I don't know what to share with you. My university didn't close. Students continue to study. We did the graduation. They are wonderful, and we are going to take the uptake in 2 months, like planned, and we will manage it. My hope is that we manage it. And my second hope is it has shown in my country that solidarity pays off. And when I saw all the cabinets, starting by the president, and after that, many leaders in this country giving their April salary for the people who will not have a job during the lockdown, this make me, it's Christmas. When I saw even in other countries, like even in a country also badly managed, where finally the community have taken over, put it barrier for taking the role of what the state should do for them, they take it and they save themselves. Navajo Nation. So there is a lot of hope everywhere, you see. And also, if we take all the lessons learned across the world, we can rebuild the health system easily, because there are so many great things done across the world.
Thank you. Chris, if we could hear from you.
I have a lot of hope too. I mean, just all the stories I've heard about how community healthcare workers have come forward and filled the gap in services, gone door to door with insecticide-treated bed nets, ARVs, you name it. People have stepped up, and it's amazing and it's wonderful. And another thing that's really wonderful, I'll just say from the United States, is the role of Africa CDC has been incredible. I mean, clear messaging, leadership from the beginning, always visible, always evidence-based, very humanitarian in its message. Africa CDC has just, wow, really come forward and made a huge splash. And that is so fantastic on so many levels, and the immediate response, but also just going forward. I'm really hoping people in donor countries are paying attention to that, and seeing that leadership, and seeing that we need to be investing in African-run approaches. You know, and I do think people are understanding that this is a moment to move away from to decolonialize, you know, global health, and that's something that people are beginning to understand, and we need to keep pushing that. Finally, I would just say, in the United States, advocates are working together and on the push for global, which has been tough, but people are working together, and we absolutely need that, and it's awesome.
Thank you. And Bailor, if you could have the last word on this one.
I think for me, the greatest hope that I have is that the world as a whole is recognizing the use of community health workers as a stronger backbone with healthcare, because we're only in the US, like Partners in Health is implementing the contact tracing program in Massachusetts, and other states are taking up, and like even in Sierra Leone, the government is recognizing that community health workers are important in fighting this pandemic and other pandemics. And I think that makes me hopeful. And also, the other thing that makes me hopeful is that, as Chris said, the step that the African CDC took during this pandemic is like they're doing an amazing job. They're following the science. They're doing all those great things. And also I hope that the other countries or the West or the donors are recognizing that and then giving them support to be able to handle what's happening in Africa. So that's my last word.
Fabulous. Excellent. So we have about 15 minutes for questions and answers, and then we will turn over to small breakout groups. So to start, Dr. Agnes, I want to turn this question over to you. It's a question from Melody Wu. And because you mentioned, addressing the lies and the mis and disinformation that's been going on, this question asks, how do we communicate better to the public about the after effects of COVID-19? How do we communicate that even post-pandemic, there will be impacts?
By panel like this, taking it, writing about that, doing radio event by people who know. And, I have seen some high-level sport people, sportsmen, who suffer from COVID and express how they have lose a little bit coordination that make them roll back in their own category. So I think testimony like that are important. And after that, honestly, put the economic things on the table. Where do we go from that? What happened to the average person who lose the job and probably will not recover it? And not only in Africa. This is a global question. And taking example of people in their community, talking about what they have experienced and what they are experiencing and what are the risks they are going to face is a very good way to inform the world, keeping the science there. And among the things that keep us optimistic is that there are still people like Fauci, who doesn't care, doesn't care, and science is science. Take it or leave it. I like it. So use people, use communities, use all the channel of communication, but people who speak the truth in their own life.
Excellent. Does anyone else want to add to this question? Okay. For the sake of time, I might move on to another one then. And Kumba, I'd like to address this one to you. It's a question from Daniel Egby. And he asks, how do we build sustainable health communities that anticipate and respond to health crises in a timely and adequate way, as opposed to the scrambling we have seen during COVID-19?
Well, with that, we need to engage the communities as soon as possible. You don't need to delay in engaging the communities, because when things like this happen, if you delay in engaging the community, things might go wrong. What I mean by that, whenever there is an outbreak, there is a lot of misconception in the communities that goes on in the community. For an example, when COVID started, when we had our first case, we realized that there was a drop down of patient access in the facility. So we didn't wait for that to go along for too long. We decided to engage the community as soon as possible, making sure they have the factual information. We engaged the radio. We had different community engagements that we held in different and chiefdoms and involving stakeholders in ensuring that they have the right information that would kind of ease their fears and help them kind of believe in the healthcare system again. So
Kumba, we may have lost you, unless that's just me.
No, I think it's all of us.
Okay. All right, so for the sake of time, we might keep moving, though that was a great response. Oh, Kumba, we have you back now. We lost you momentarily. If you'd like to have a final word.
Hello?
Yes, we have you now, but we lost just the last end of your response. If you'd like to.
Yeah, so I was just saying that it's always important to engage the community as soon as possible with factual information to ease their fears.
Excellent and very well articulated. Thank you. Chris, I want to direct this next question to you. It's from Paul Davis, and he asks if the Global Fund can be a vehicle to stop pandemics and meet the international health regulations. Is there a better vehicle through which donor funds can be channeled to fund country-owned efforts to meet these regulations and stop pandemics?
Great question. Global Fund is a great model in so many ways. One is that it involves civil society. It is really focused on building country ownership and fostering voices broadly in countries in shaping what the programming looks like. It's also highly accountable. Donors like it because it's very results. Well, everybody likes it because it's very results oriented. For donor countries that are funding it, it reports on particular progress in the 3 disease areas every year. And the other thing is it's the biggest funder of health system strengthening in the world. It dedicates about a quarter of all of its money every year goes to health system strengthening functions. So it's a good model. So look, it's worth asking that question as the Global Fund heads into its next 5-year strategic planning effort. And I personally, I support all of us looking at the Global Fund growing in its mandate, but as someone who's very attendant to what the US Congress wants to fund, I also have another perspective, which is we absolutely in the United States have got to maintain bipartisan support for the Global Fund and for US leadership in terms of financing the Global Fund. And so whatever happens with the Global Fund in the future, and again, I think the Global Fund has a huge role already that it's playing in COVID. And I think that'll affect our perception of the Global Fund role in the future. But I would say I would urge that we not get away from some of the things that are really working right now, which is very much focused on results in focused areas of global health. I think there's room to, I think one thing as advocates that we need to challenge ourselves to do is say, what are, in addition to lives saved, for example, or mortality reduced in AIDS, TB, and malaria, what are other metrics that we can use to report on success in global health investments that speak to more of a stronger systems rather than just individual infectious diseases? Is that lower child mortality rates? Is it another marker? Are there a couple markers out there? But all I'm saying is I can just speak as someone from the United States, but as someone from the United States and who, wants to keep Congress engaged in putting a lot of resources into this, it's got to stay results oriented, and it's got to not move very far from that. But I do think we can think more holistically about what results really need to be in global health. And for sure, we can open up additional options to use the AIDS, TB, and malaria platforms, whether it be the Global Fund or the bilateral programs like PEPFAR, use those platforms more broadly for health. There's a world of opportunity about what we can do. I just hope that as advocates, as we look and think more holistically, that we also think about the results orientation that I think a lot of donor countries really need to keep the cash flowing, frankly. And that's an interesting dance to do, and a balance that we need to work together to find.
Thank you. Are there any additional responses to this question?
If I can add something, Chris, there is a very good way to do that. If you can start collecting the country where Global Fund money was not will not have been, or was not able to be used because of COVID, and see the country where it works well, how the Global Fund has helped those countries where it still work well to perform. And I have a country here that is already an example. We build and strengthen the health sector so that we are resilient in front of that situation.
Let's talk. I mean, I really, I agree. I think that's right. I think even as in the midst of responding to this terrible thing, we need to pull out those lessons about how the health system investments already have been contributed to the success that many African countries have seen already. That story has to be told. I agree.
Thank you. For the next question, Bailor, I'd like to start with you on this one. It's a question from Ugoji Eze, and they ask, how can the African continent develop and indeed implement policies and programs to strengthen preparedness, build resilience as regards to COVID-19? And what international support do these countries need in capacity, knowledge, access to science and technology, and financing instruments? So it's quite a big question.
Oh, yeah, I think my thoughts are like actually making the African CDCs take a lead on this and like helping countries and like develop a generic plan that each country can develop a specific plan from or can adapt and develop a specific plan for. In terms of resources, obviously we need a lot of resources to be channeled through the African CDC in terms of research, in terms of capacity building and research and all those things. I think this is a high time that African CDCs take a lead in the scientific environment in Africa and make sure that like science and other things are speaking to policies that are developed and like in the continent. And like, for example, they're taking a huge move right now to do a zero survey in many African countries to get to understand the global, the continental impact of the COVID, which I applaud them for. And I think just supporting them through the international community can support them to lead the responses in Africa. And I think we have this African CDC strengthening.
Bailor, we may have lost you. Checking in, is that just me or that's others?
It's sort of us.
Okay. Okay, while we wait for him to come back into present time with us, are there any other responses to this question?
It's a huge question, but again, outbreaks, the outbreaks, preparedness and response is a policy that should be there at all levels, national, what you do when it became a pandemic, what is the role of the Prime Minister, the Minister of Health, the Minister in charge of disaster management, and how is the logistic, what we do with the private sector, the religion, etc. What we do at district level, what is the role of the mayor, what we do at etc. up to the head of the village. So this is something you build quietly in between two crises. So it exists, and there are great examples in several countries where everything is there. You have a Bible, problem arrays, everybody take the books and know what to do, have the responsibility of each and every one. We know when we can extract the money for, the reserve, etc. The Minister of Finance is informed, all local government is informed, the president take charge.
Excellent. Bailor, we see you're back with us, so we don't want to cut off your response if there's anything else you'd like to say.
You're on mute. He's on mute.
Yeah.
He's on mute.
Yeah.
Yeah.
Internet is I just hotspot now, but like, yeah, as I was saying, like actually using the African CDC could be the way to go, and supporting them and strengthening them to become very strong and functional we need resources for that, and African CDC need resources to be able to work harder and develop this generic, develop generic policies that can be adapted by country, by member states, and like moving forward. So.
Excellent. Well, we've reached time, but I think that's a wonderful note to end on, that we need plans at every level and that we need resources to support the development and implementation of these plans, to acknowledge the leadership of great organizations like the African CDC, and to continue to talk with one another so that we can form a global response to this, because none of us are well or have the full access to health as a human right, unless we're thinking about all of us. So thank you so much, Dr. Agnes, Chris, Bailor, and Kumba. It's been a great conversation. I think there's a lot more that we could look at, which will hopefully be considered in the breakout groups that are coming up now. So I will hand over to Kimberly, and thank you very much. Have a great day.
Thank you. Thank you very much. It was great to be with all of you.
Great to be part of it. Thanks.
Thank you.
Just to quickly introduce myself. Hello, everyone. My name is Kimberly St. Fleur, and I'm an undergraduate student at Cornell University and also a member of the Right to Health Action Planning Team for this webinar. I just want to start off by giving a huge thank you to our panelists and our moderator for this really engaging discussion, and to all of you for submitting your thoughtful questions. I hope all of you enjoyed the panel and learned a great deal from our inspiring speakers. Just to get a read on how everyone is feeling, we're going to launch another quick poll before we proceed. So please take a moment to fill that out now. Thank you all for your responses. We really appreciate the feedback. I hope that today's discussion has inspired you to think about what it would look like to take action in this moment. One action that you can take to impact US policy specifically is to send a letter to Congress urging the adoption of a pandemic prevention plan that, one, includes investments in global health systems to stop pandemics before they start or spread, including $4 billion for the Global Fund. Two, guarantee affordable medicines and vaccines are available to everyone, everywhere, especially for products developed with public funds. Three, launch a permanent public health course of new union workers. And lastly, four, take action against climate change and related zoonotic disease transmission in top global hotspots. In addition, if you want to take action in collaboration with individuals in your area, join a state-based team of activists in pushing for a just and equitable global response to the COVID-19 pandemic.